We appreciate you taking the time for our daily briefing. As everybody knows, these are extraordinary times. They are difficult times. They are challenging times. And we have a lot of questions, and we still are short on some answers. But I appreciate the fact that everybody's kind of joining together to see if we can't find answers to the challenges we face and working together. And certainly I see progress, and I'm optimistic and very hopeful as we are pulling together here in the state of Utah. Let me just mention, I know that people are hurting, and my heart goes out to those who have this infection. We all have friends or family members that have had to go through this, and we know how difficult it is. And certainly to those who have lost some loved ones to this coronavirus, we certainly offer our best wishes and condolences. Again, I hope this motivates all of us to redouble our efforts to do what we can to stop the spread of this virus, to protect the health of the people that we love and the people that we know, and even the people we don't know, not only here in Utah, but throughout the country and around the world. We also are concerned about the economic health of our state. We see a doubling of those who are getting on unemployment insurance. The last 2 weeks, we've had more people get on unemployment insurance, make the request and the application that we had in the entire year of 2019. So we know that there's other things that are causing anxiety out there and causing people to be a little fearful. So again, all of us working together will help us get through this rough stretch of road and emerge on the other side intact and strengthened. Everything we're doing is working to help bend the curve, and I think that we can do better than what the typical projections would be for our state by those that have models out there. But it'll only happen if, in fact, we work together. These are times that I'm concerned about more than ever. The next 2 weeks are critical. We have sunshine coming. It's springtime in the air. Spring breaks, conference weekend. The temptation is for everybody to go outdoors and do something with friends. I understand that urging, but this is a time for us to really look and say we may need to change our behavior, our social actions and what we've done, our social interactions, how we've conducted ourselves in the past, cannot be business as usual today because of the COVID-19 virus. So again, let me just remind everybody, I appreciate those who are complying, but there are some out there that are not doing as well as they could or should. And so let me make this as a reminder to all of us to make sure we follow the directive. Travel should be eliminated unless it's essential. If people think somehow that they can leave their primary residence here on the Wasatch Front and go on to a vacation home or a hotel in southern Utah, you're not interpreting our directives correctly. This requires you, if you're on your way down I-15 right now and can hear my voice, I'd ask you to turn around and come home. We, again, need to stay safe by staying home. That's the best place, and we're going to have to all adhere to that counsel and do the best we can. And I know it's tough. I know it's not easy. Do not spend your free time outside in groups of people. Again, I know we're social animals, but we need to change that. Do not have visitors into your home. I know that's hard to do too, but we cannot have people come into our home. We don't know what they're bringing with them. And again, this is part of the necessity to isolate, stay safe, and stay at home. I know there's a tendency, again, I like a good group volleyball game as much as anybody, or pickup basketball, and we need to avoid that. Even choir practice. I know we have church services and congregations that get together. Those should be avoided too. Even small choir practices are not acceptable in our current environment. So small group gatherings just shouldn't happen. And so let's see what we can do to make sure that we, in fact, abide by the directions. I know we have students coming home from school and faraway places, some missionaries that are coming back from different churches. Again, we'd hope people coming back from school do not think of this as some kind of a spring break vacation, and they start to congregate with other students, other youth groups. That should be avoided also. This is not the time to have these spring break gatherings. Again, let me just remind everybody, stay safe by staying home. Do not travel unless it's essential, and we'll all be better off as we slow the spread of this coronavirus. Now, there are things that are acceptable to do. Certainly, we want to still stay engaged as we are able with the economy. Again, taking appropriate actions. Our business personnel, the employers, need to make sure there's a safe area for people to come and engage in their work. Again, this is repetitious, I know, but we were finding that some are not following it. So we're just reminding everybody, and let's see if we can't re-engage now. This is critical time. A safe environment for our employees to come to work in, safe spaces, social distancing of at least 6 feet, sanitation, hand sanitizers, Clorox wipes, wiping down doorknobs, handles, flat surfaces, all those things that we know we should do. Let's make sure that we are doing. Outdoor recreation is fine. We hope people can get out and enjoy the sunshine, walking the dog, jogging around the block. There's things we can do, but not in groups. And again, we need to make sure that if we are jogging around the block, that we do it with appropriate social distancing, and that will be acceptable. Again, most of this, as you know, is just common sense. This is using your own best judgment. Government can't figure out every situation or scenario to give you a list of guidelines. So please understand the protocols of safe distancing and staying home is a good place to be over the next few weeks. With that, let me just mention a couple of things that are new. Again, this is not altogether new, but as you know, we've closed the state parks. So for that family that's on their way down I-15 that's just hearing me chastise you and say if your home's on the Wasatch Front, turn around and come back, because Snow Canyon is not going to be open or available to you. Other of our state parks are going to be closed, and people will be there, personnel, to monitor that situation. Again, I know that's an inconvenience, but that's something we need to do to protect us against the spread of the coronavirus. And today, after consideration and discussion and consultation with the Washington County elected officials, and also working with the Department of Interior and Secretary Bernhard, we are announcing that Zion National Park will be closed immediately. Those who are in the park right now will have the rest of the day to gather their belongings and to leave, but no more admittance will come. Again, it's an example of where we have people that come into our state. In fact, more than 50% of the people that go to Zion's Park are not Utahns. They're from outside. In fact, it's probably close to 75% of people that are not Utahns that come into our Zion's Park and our national park. So we are taking steps to close Zion's Park down immediately. Again, I appreciate the fact that we've worked with Secretary Barnhart and the Secretary of Interior, and he's been very cooperative, giving local consideration to our needs. And so I appreciate the work of the Secretary in cooperation with us. Also, we're working with the state of Arizona and the Department of Interior also to see about shutting down the boat ramps at Lake Powell over the weekend. Again, we have so many people that come from outside our state, and that's a dangerous situation. As we all know, most of the infections we've gotten here in Utah have come from outside our area from some other place. So we're working to have that closed over the weekend. And as I said, the next 2 weeks are very critical. So we're taking a little more aggressive stance and measures to stop the spread by locking down from people coming into our state. With that, again, we appreciate all those who are doing good work in complying with our directives. We think this is absolutely necessary, and we would hope everybody would take and review where they're at and what they're doing, and make sure that what they are doing is in compliance with the directive we have throughout the state of Utah. With that, let me move to a different subject, and that is, as I mentioned here earlier this week, I have the appointment here. I've made the appointment of General Jefferson Burton to direct the COVID-19 response at the Utah Department of Health. I've known General Burton for a long time and have a great admiration for what he's done in his service to his country and to the state of Utah by everybody's, I think, admiration for him. They would call him a general's general. He's been involved in the military for 30 years. He's a two-time battalion commander, including commanding a battalion of the 1st Armored Division Task Force in Operation Iraqi Freedom. In 2007, General Burton was appointed as the Deputy Adjutant General for our National Guard, commanding over 5,600 soldiers of our Utah Army National Guard. And then I promoted him to be the Adjutant General in 2012, where he served for 7 years. And I've turned to him for help and leadership and the command of our troops, oversee the training and the mobilization of over 7,500 soldiers and airmen. And he's done a wonderful job and deserves his retirement, but we've called him back because of his skill set to help us in this kind of new combat, this new conflict we have here with this coronavirus. It's been referred to as a war, and maybe there's a lot of similarities. The good thing for us is that General Burton has been prepared his whole life for this very moment. And maybe at no other time have we needed his service than right now today. Not only does he have military experience, but he's done extensive work on disaster preparedness and response. And so his preparation and all the work that he's done, it really prepares him to take over this new responsibility. And I'm excited about him being part of the team and helping to lead us. And I think it helps us to have hope and optimism that we're going to solve this problem. So I've asked him to come here to introduce himself to those who don't know him and also to answer some questions. So following his remarks, we'll hear from Commissioner Jess Anderson, who's leading our EOC team, our incident command. They meet every day, and he'll have a chance to bring you up to date on some new information, and then we'll take time for questions. So, General, we'll give you first crack.
Well, thank you very much, Governor. It's an honor to serve, and I'm proud to be a part of this team and proud to work with the great employees of the Department of Health. I want to just off the top also shout out to the great professionals within the county health departments that are working so diligently to protect our citizens and our first responders that are out there facing this unprecedented virus with courage and skill, taking care of the needs of our citizens. So thank you. I'd like to also point out that unless you were alive in 1918, no one's really lived through a period of time quite like this. And so it's so important that we comply with the directives and that we work together so that we can ensure that we get a handle on this virus. So today I wanted to just share a few numbers with you. I know the media has been interested, the public is interested in some pertinent numbers for facilities and personal protective equipment. So I'll share some of those numbers with you today. First of all, we've identified that Utah has around 600 ICU beds in the system. Currently, 297 of those beds are filled. Bear in mind, those numbers change hourly based on needs. And so those beds are being used for non-COVID patients primarily, and those numbers will fluctuate, but the capacity is 600. Per the modeling that we're using, looking at the University of Washington study and report, we think at peak we're going to need 227 ICU beds. And again, those numbers will fluctuate based on other patients with other needs. Regarding ventilators, and you've heard a lot about ventilators as you've watched this nationally. We currently have roughly 1,000 ventilators, just a few less than that, that are capable of taking care of patients with COVID-19. Currently, with those ventilators, though, 28% of those are being used with other needs, other patients. And so 72% of the ventilators are available. And based on the studies and the graphs, we believe we will have sufficient ventilators as well in Utah. And again, I just stress that Utahns strive to be prepared, and there was a lot of preparation that went into this. Now, the area that we're struggling with, and it's changing daily, is PPE, personal protective equipment. So I'll give you a quick rundown on that. We believe that we're going to need about 3.6 million N95 masks. We have received 165,000 of those masks and distributed 57,000. We have 3 million on order, and they're coming in daily. Gowns, we anticipate we're going to need 4.7 million gowns. We have 61,000 on hand. We've distributed 18,000, And bear in mind that the healthcare facilities had a stockpile of their own before this began. Face shields. Anticipate needing 2.2 million of those. We've received 76,000 of them and distributed 13,000. And it's important to note that we're distributing them daily as quickly as we can out to those facilities that need them. I want to express gratitude to the private sector. That you saw some of that yesterday. They came forward to help. So it's public-private partnerships, people tapping into supply chains to solve this problem, working collectively. That's what Utahns do. And I'm so grateful to be a part of this. One thing I want to share, if you have a need or desire to volunteer or get involved, the website is coronavirus.utah.gov/help. And that would be a place where you could go and identify the fact that you want to get involved. Thank you so much. Commissioner.
Well, thank you, General Burton, and it is indeed a pleasure and honor working with General Burton side by side down in the emergency operations centers with the Department of Public Safety as well as the Department of Health and other all aspects and other state agencies that come together. By way of an update coming from the Emergency Operations Center, last time I spoke to you, we gave you an update on a few things that we were working on and that we had accomplished. A couple more things here is that we are partnering with Salt Lake County to provide alternate care sites or otherwise overflow hospitals. This is a proactive response directly related to COVID-19. It is important to note that an alternative care site is not for COVID-19 patients. The COVID-19 patients would remain in our main hospitals where proper care and attention can give to them, and especially knowing how vulnerable people are with the spread of this particular virus. We are currently stocking our alternative care center with 250 beds. We have that available and it is already established and set up. Going forward, we have a capacity for an additional 750 beds if need be. This will allow our traditional hospitals to reserve the capacity, as like I mentioned, to treat our COVID-19 patients as necessary. The alternate care site is a location with hospital beds and as well will provide services for medical care and injured and sick patients, both in continuing care or chronic conditions in non-traditional environments. It is not, again, for COVID-19 patients. In any incident where we may have mass injuries or fatalities, it is standard operating procedure to plan and designate alternative care sites that can serve as hospitals, shelters, and short-term housing or trauma units. We hope that we will never have to use our alternative care sites. However, it is a prudent and a proactive approach that we here in Utah are taking very serious. We are monitoring very close, and if we see an increase or a spike in the COVID-19 patients over the next couple of weeks, as Governor mentioned, it very well could overwhelm Utah's healthcare system. The best plan of action is to keep vulnerable people healthy and out of hospitals. We simply do that by following the guidance the Governor just reminded us of. Stay safe and stay home. We would stress, again, much of the general hygiene purposes of frequently washing your hands for 20 seconds or more, avoiding touching your face, coughing or sneezing into tissues or your elbow. Avoid groups larger than 10 people and even gatherings of people outside of your household, and maintaining a 6-foot distance between you and others. Some of the questions that have come up about perhaps how you may staff an alternative care site. We have identified and are considering many of those options. Some examples would be with health or medical professionals that are idle due to COVID-19 policies, medical nursing or health instructors and students, retired medical professionals, the Medical Reserve Corps, who is a volunteer group, and as well as staff from hospitals who send patients to the alternative care center. We also open that invitation up to all individuals with some sort of medical skills that have to offer. We call for your ability, those that fall within these categories, to make it known to us. We have a need to be able to identify who you are now, so that when we do need to call upon you, we have that ability to do so. I would encourage you to go to coronavirus.utah.gov/help, to which you can put in the proper information listed on that website that we will be able to contact you and let you know further. In addition, we also are establishing some quarantine and isolation sites throughout the state of Utah. Quite simply, these are areas where either households are compromised, where proper isolation cannot be given as appropriate or recommended, that we have the ability to then put you in a facility or a place of isolation. We are working with the county agencies on this effort throughout the state. These again would address anybody who find themselves either in a homeless situation or otherwise in the state without a place to go, of quarantine and isolation sites. We are not releasing the locations of where these quarantine and isolation sites are as we continue to work with the county, but we have capacity to be able to house individuals as it's made known to us. Thank you for your time.
Well, thank you, Jess and General. I've been asked by Paul to just reemphasize, in case it was not understood correctly, our state parks are open only to those who live in the county where the county or the state park is located in. So the county, let me say it right. The state parks are open, but only to those who live in the county that the state park is located. We will have personnel there to monitor that. So they're not closed. That was a misunderstanding. They are open, but only to those who live in the county where that park's located. So with that, we'll now open up to any questions you may have.
Thank you very much. Governor, a couple of weeks ago, you told me that you had not issued a mandatory stay-at-home order statewide because we are not at that point yet. Why has that order not been issued, and what will be the determining factor when it is?
On recommendation from the local health departments throughout the state and the local government officials throughout the state, as well as overseen by the State Department of Health. That's in review every day. And of course, we have our Commissioner of Public Safety, Jess Anderson, and now General Jefferson is going to talk to us about that, Jeff Burton. And so we'll continue to monitor that. The orders that are in place, are virtually the same. If you look at what's been done by the different counties and what our directive is, they're virtually the same. And one has said we're going to have a power of law behind it, but we're not going to enforce the law. We've said this is a directive which we expect everyone in the state of Utah to abide by. There's not really a lot of difference. I'm expecting the people of Utah to use their good common sense, their desire to protect themselves and their family members and friends, and do what is right. And I think so far they're doing that. Take a look at the roads now. They're almost abandoned. So people are, in fact, telecommuting. There's not as much travel outside, so that's good. But that will continue to be monitored. We're trying also to find the appropriate balance. Again, as you know, what we just announced here, we've had more people apply for unemployment in the last 2 weeks than they did in the entire 2019 year, 52 weeks. So there's a significant concern out there. And so we don't want to end up having the vice grip on the economy any more than is happening right now. So it's a balancing act. I think we're balancing it pretty good. We give local control for the regional differences. I think we've struck the right balance. But we'll continue to monitor that. If people don't comply, we can take more aggressive steps if we think that's necessary.
Thank you. And Governor, you announced the closure of Zion National Park today. As you probably know, the mayors of Springdale, St. George had called for the closure. What coordination was done with them and the federal officials? And which federal officials did you talk to for them to close Zion at this point?
I don't know who actually did the communications. Do we know that, Paul? And answer the question. But okay, General.
Yeah, great question. Just so you're aware, the mayor of Springdale and also the mayor of Rockville came online and asked for this closure. Obviously, we're cognizant of the economic impact it'll have to those communities. They're right adjacent to Zion National Park. But based on some research, based on what's been going on at the park, based on some of the difficulties of maintaining proper PPE in the park, it was decided that this was a prudent measure and the closure needed to happen. So coordination was done with the Utah State Health Department. We agreed with that based on consultation with the governor, and then coordination was made nationally with the Secretary of the Interior to make that happen. And we will add that the department moved very quickly on this once we got the ball in motion. Does that answer your question?
Absolutely. And one more quick question. General, if you can discuss a little more of your role in this, how you got into this, as well as are you basically leading the effort at this point?
I'm having a hard time hearing you. You asked me how I got into this. I love this governor and I love this state. And when asked, I didn't hesitate. There was no stutter step here. I love the citizens of Utah, and we need to bring our best minds and our best capabilities together. And I think the governor has masterfully done that. This unified commander, Jess Anderson, is second to none. And I believe that everything that can be done is being done. And I just wanted to be a part of that.
Other questions? Other questions?
Yeah, this is Kyle Harvey with Channel 2. I want to get back to the stay-at-home order. If and when that would be enacted, what would change from the situation we have now? Would more businesses close? Would law enforcement be more involved? And that would be enacted. What would change?
I think I understand the question. It's a little garbled on our end here. What would change the order that we have in place currently? Again, we monitor the data. We are finding, I think you'll hear from our epidemiologist a little later on, that as people go in and get tested, about 5% are finding themselves affected with the COVID-19 virus. That's been pretty constant. The more that we test, the more the numbers, but the percentage seems to remain the same. As we go through this process and see what's going to help change and bend the curve, if we have to take more aggressive steps, we will do that. It's going to be based on data, information. It's not going to be based on just a feeling. And so we monitor that every day, and that will be what, if all of a sudden we had a major spike and something, an outbreak of some extraordinary means, that would certainly be an example of what would cause us to maybe change and reflect and review the current orders we have in place. Next question.
Hi. Currently, California just today said they're in need of 50,000 additional hospital beds to accommodate their surge that's coming up. Are you guys there? That gives the potential for a scenario where the hospital system in California is so overwhelmed that people need to flee, meaning going to places like Las Vegas to get care, whether that's non-related to the COVID virus or non-related care. And then also those people in Las Vegas could then spill over into Utah. Is there any plans underway for a scenario like that to protect our hospitals, but also to potentially help some of those people at the border of Utah?
Commissioner Anderson?
It's a great question and a great point brought up on the protection of our own infrastructure here in the state of Utah. I can tell you that as far as all the projections and modeling, the statistical data that we are closely monitoring, we are confident that with what we have within our own capacities right now here in the state, that we will be able to either mitigate or otherwise be prepared for what we see within state. Something that we do need to be prepared for, and as you bring up, is perhaps those that are fleeing from other states or other parts of the nation that are coming to the state of Utah for that care. As you know, there's certain procedures and non-essential functions of medicine that are shut down right now, focusing on the COVID-19 problem. And so as we, of course, accept the ability to help all people, we are very sensitive to that and are watching it closely. Something for us to monitor, but we're confident with where we're standing right now, what we're preparing for, these alternate care sites, and as well as the capacity that we have internally within our own hospitals, that we will be able to continue to provide proper health care for those within the state.
Thank you.
Let me just add to that, if I could. We have conversation with the president and the vice president about twice a week. It's governors and the president, vice president, and his staff. They are expecting the states to handle their own issues. They're certainly there with FEMA and others to give help. And certainly the Congress has stepped up with $2.2 trillion in what is maybe just the first phase of this to help us get through this unique and challenging times. Our first obligation is the people of Utah. And we're going to make sure that we are capable of doing what we need to do for the 3.2 million people of Utah as we address this unique challenge. That being said, we also have a weekly conversation with the National Governors Association, and we talk to each other as governors, what we are doing, what we can learn from what you're doing, and share best practices. We certainly are not above and certainly would be willing to help where we can to other states that are in need. I think that's the American way, and that's the way we ought to be treating each other. So those issues are being addressed. We hope that each state will find ways to address their own unique challenge. We certainly are doing that here in Utah. Another question?
Governor, given that you have just asked for the Zion National Park to be closed and you're looking at Lake Powell possibly closing the boat ramps, are you considering any kind of travel restrictions at this point?
Well, we have travel restrictions now. We've just got through saying, as we've said for the last few days, all travel that you engage in should be essential. We want you to stay home. We want you to stay safe because that's the best place to be, is at your home and that kind of surrounding localized area. So we're trying to stop travel to different regions of the state. Again, we have spring break, we have springtime, spring fever. People traditionally get out and look at a lot of the beautiful vistas and venues of Utah and engage in a lot of different things. We're in a group setting. We're just saying that's not right today. We do care about those who come into our state, particularly from outside of our borders. Our national parks, over half of the people in times past have been international visitors, not Americans. We've done a great job of promoting our tourism and travel trade in the state of Utah in a significant way, and our 5 national parks down in southern Utah have become a hotbed of activity. Well, right now, that's not what we want. International visitors are not needed or desired. And now the problem, of course, is just those others that come from outside the state, which is a significant percentage. So taking away the attraction is another way of slowing travel into our state from outside our borders. So that's why this is being done. And I think it's going to be hopefully temporary, but it will help us get a handle on the travel that comes from outside our state, which is the most risky, into our state. One last question.
Can you guys hear me okay? This is Brittany from ABC4. This is a question about testing. And I have two scenarios. One, a fast food employee tested positive for COVID-19. A worker who was in direct contact with that worker was not able to get tested because he did not show any symptoms, but he'll be back at work next Thursday. So we have public officials urging people to get out and eat and keep the restaurant industry afloat. But how can we be sure that these workers who aren't being tested just because they don't have symptoms don't have the virus? And then also, second scenario, people aren't being tested who show all symptoms except for fever. We know that a person who has, in this scenario, a person has a roommate and they're putting everybody else in a weird place or at risk because they don't know if that person has the virus because they can't get tested because they have all the symptoms except for a fever. So the question is, how do we know that the measures are working if we're not testing everyone who has potentially been exposed? And if we have an increase in test capacity, who's getting these tests?
Again, both scenarios that you've mentioned should not, in fact, be occurring. We've always said that the number one issue and the biggest challenge for this state and for all states as we've gone into this COVID-19 challenge is the ability to test the people. We've said that testing should, number one, be prioritized so those who do have symptoms, you don't have to have all the symptoms, can have access to a testing and be able to, in fact, find out whether they, in fact, have COVID-19 or not. We've expanded the testing so that we're now doing with what happens with Silicon Slopes yesterday. That's bringing on another 1,000 tests per day. You can go take the survey. They will guide you through the process. And at the end, it'll direct you to our different testing laboratories. We have drive-up testing facilities in many locations now. It's expanding from Logan down to St. George. So again, talk to our Department of Health. If you have some problems, they will help guide and direct you. But anybody who's got symptoms for sure should be able to be tested. Likewise, those who've been exposed to somebody that's tested for COVID-19 also should be able to be tested. So again, the testing slowdown that we've experienced in the past is being alleviated. Our goal is to have 7,000 tests a day. And right now, anybody who has symptoms, we don't have a backlog anymore, so people should be able to get tested and have the results in less than 48 hours. So again, if you have any, if there's any situations where that's not occurring, let us know. We'll help facilitate that to make sure that it happens. We do have the capacity now to do that. All right, thank you very much. We'll see you again Monday.